All right, hi, this is Dr. Rob Lindsay, and I'm here with Amy, and Amy is the mom of one of the patients that came in here. His name is John Michael, and he's 13 years old. So thanks for coming.
Sure.
And I guess the main question I wanted to ask was, what was it that brought you guys in here in the first place?
John Michael was suffering from really serious tics. His head was shaking back and forth. This had gone on for a couple of years. I noticed them slightly at first, probably a couple of years ago, where it was just not really noticeable to anyone else, but as his mom, I started picking up on it. And then I noticed the tics started to change. They started to kind of rotate around his body, where he would have head tics, but then also tics with his hands. Then developed some vocal tics, where he would either clear his throat or he would make sounds like woo! And I knew that this was involuntary. It wasn't something that he could really control, and it's something that he wasn't even noticing. But as those tics progressed over the years, I would say last summer it just came to a head where I knew I had to do something. I had a moment where he was playing baseball, his favorite sport, and he was up to bat, and I was sitting in the stands, and I noticed when he was trying to hold his bat up and watch the pitch come, over the plate, he couldn't even hold his head straight to keep an eye on the ball. And it became very noticeable. It just hit me that this is not a little tic anymore. This is controlling his life. And it was something very visible to everyone else as well. And I had talked to doctors about it. And I had always been advised that if I just ignore it and not draw attention to it, that hopefully it would just go away, that there was really nothing that they could do other than medicate him and try to sedate him, and that wasn't ever an option for us, and it really wasn't an option for the doctors either. So basically I was told there's not a lot we can do for it. I wasn't okay with that. I'm just not okay. As that mom instinct, I just knew that I had to pursue something else.
Something else. It wasn't just in his head, so to speak, from a well, he'll grow out of it, or
right, and that's what we were hoping for a little while, that he would grow out of it. I had some other doctors tell me, that sometimes in early adolescence, those come on, but it was just getting worse, and I knew as a mom it was up to me to advocate for him and try to do something.
And the thing is that in some of these, in a lot of these cases, the patient, whether it's mom or it's kid, they're told that it's in their head, and that's partially right, because in his case it was. He had a brain-based challenge where he had some neurologic just misfiring going on. So that's one of the things we had to work on. So so we started care back in August or something like that, and
I think it was June.
Was it June? Okay. And we did some dietary changes. And so tell me what, when did you start to notice some changes in his behaviors?
We noticed changes within 2 to 3 weeks. We changed his diet drastically. We put him on the autoimmune protocol that you recommended, which meant no dairy, no wheat, no grains, and then even nightshade vegetables we pulled out of his diet because we didn't want anything. We wanted to give his system a chance to really calm down and reduce any inflammation in his body. And within a couple weeks, he was completely tick-free. And has been ever since. That was August, it is now December. Or excuse me, that was June, it is now December. And
so the tics went away fairly quickly, but that didn't mean that he was necessarily all the way healed, because our continuing neurologic exam was showing some things, and so we did some more neurologic rehabilitation for his brain, continued with diet and some supplementation, and so, how's he doing now?
He's doing very well.
Great.
Thank you.
I
mean, the transformation has been really such a huge gift to him and our family, him socially, just being able to, as a teenager, to have interactions where he is calm and confident. And you know, as a teenager, you don't want anything to draw negative attention to you. We all have things, trials that we go through in life, but as a mom, I feel, I just feel so much better knowing that he is at his best, he's calm, he's on board with the diet changes. He knows how he feels when he starts to eat bad or make wrong choices in eating, and because he sees how it affects his nervous system. And it's just so good to send him off to school knowing that, again, that he's calm, he's concentrated, he's focused, and really able to come just be his best self. Yeah,
he's doing great, and it's been great to work with him. And one other thing, lastly, is just I noticed at one point you had said that, and we hear this over and over and over, that because it wasn't just a diet change for John Michael, but the whole family took part in it, and as a result, then even you said your husband started to feel better. So when you do this kind of work, you'll notice that your life will change, you and your families as well.
Yeah, absolutely. We knew that the more you kind of introduced us to things that can be toxic to our bodies, the more we were educated, the more I realized that, you know, well, we were, number one, trying to support our son, and we just told him we were all in this together. But the more we learned, and the more we learned how to make exchanges in the way I cooked, like for instance, you know, using coconut oil instead of vegetable oil or olive oil. The more I learned to kind of make those changes, the more it just became part of our routine. And yeah, my husband lost 20 pounds, awesome. And we just all feel so much better. And it's just been a positive change for all of us.
Awesome. So, great. Yeah. Awesome. Well, thank you for coming in and sharing that with us. And like we said before, it gives people hope that maybe feel like they've lost hope. So,
absolutely.
All right. Thanks again. Thanks, everybody. We'll see you on the next video.